the advent of the dreaded Delta variant of COVID-19 in Nigeria, there seems to be apprehension brewing among managers of public spaces in heavily populated urban centers such as Lagos. But the concern among proprietors of primary and secondary schools is on a different level, given their enormous responsibility of keeping children under their care, safe and secure at all times. Well, joining us now to have a conversation around this subject matter is Modupe Adeyinka-Oni, Executive Director of Standard Bearer School in LEKKI, here in Lagos. She'll be speaking about the safety measures for school owners regarding the COVID-19 pandemic, as articulated in her EBook guide, Need for Proactiveness Among Parents, Guardians, Health Authorities, Members of School Staff, as well as sterilization of facilities. Well, good morning, Ms. Modupe. Thank you for joining us on the morning show today.
Morning. It's really nice to be here. Thank you for having me.
Great. Well, the Delta variant has been described by the World Health Organization as the most transmissible variant. The WHO says the variant is responsible for the spike in about 98 countries across the world. Now, as cases continue to rise in Nigeria since the variant emerged, what should parents be aware of, and what danger does the variant pose on children that are vaccinated or aren't vaccinated?
Well, I think that the most important thing we all need to know in Nigeria today is that even with our double vaccination, we are not immune to the Delta variant. And as a school, it was one of the reasons why we decided that when we had a positive case, that we should just shut down the school to contain the spread. I think all educators need to understand that COVID-19 is with us. We wanted to believe that it was no longer in Nigeria, but it is. And so the only thing we can do is be proactive if you have an incident in your school. It's nothing to be afraid of. We just need to be safe for the sake of our children.
All right, Madam Modupe, that's a good one. Let me first congratulate you on the EBook guide. I think that's a brilliant initiative, actually. But then I'd like to ask, is this just for pupils and students of the standard bearers, your own school, or for everybody? If it's for everybody, how are they going to make use of this? Are you engaging with other stakeholders? And what, in specific terms, do you think they should take away from this EBook guide?
Okay, so the EBook that I put together after we had one single case of a child coming down with COVID was like a guideline for school owners and for parents, because I walked myself through the process, and I think I was instinctive in what I did. And I realized that there might be some people who might not be able to be as proactive. I'm fortunate because I grew up on a university campus. I had both parents working in the medical field, so I understood instinctively what to do in situations such as we found ourselves. And it wasn't a question of postponing anything. I knew taking decisive action was the best way to go in case, we had other cases. As it turned out, we had only the one isolated case. And so for any school owner, the EBook is just as a guide to help them understand what they need to do. I would love to say that any organization can use it, but I did direct it at school owners. And what I plan to do is it's going to go on Facebook today, both the school's Facebook page and my personal Facebook page. And I belong to a lot of associations. I will put it in our group chats so that everybody can see it. I know nobody wants to have the virus stopped by their school or their organization, but our reality is that it might. And so the EBook is just for everyone to know that in the event it does happen, these are some of the steps that will help in curbing it.
That's fantastic. Still on the variant, it's believed that it is somewhat more resistant to COVID-19 vaccines and may also be associated with greater risk of hospitalization. Now, what measures have you guys put in place to sensitize your staff, parents and children on the risk associated with this particular variant? I just heard you say one of your students came down with the virus, with COVID-19. Not sure which one it was, but...
Well, thank you for that question. One child did come down with it because her father, who had the double vaccine, caught COVID. I don't know if it's a Delta variant or whether it's just COVID itself. But the truth is, being vaccinated doesn't prevent us from getting COVID-19. What will prevent us is if we mask up and we follow all the protocols. And so for our teachers, before this incident happened and we voluntarily shut down our school, about 40% of us had been vaccinated. And what we've done is we've made arrangements that everybody should go and be vaccinated while we're away from school, and we're asking that they come back to school with their COVID passports. For the children, we continue to engage with parents at home, and we had asked our parents to also stay isolate. So if there's any case, we monitor to find out if anybody is having a temperature rise, and so far, to the glory of God, we don't have any incidents at all. And before we did go on the lockdown, we had actually done some social tracing with the parents, and we had got the people who we felt might be in contact tested, and they all came out negative. So when we do go back to school, we're just going to stay back in our bubbles, because standard bearers, we've always been very COVID compliant. Like I said, being that I have that kind of background of working in my parents working in a university, and when things came out, be it smallpox, measles, it was something we talked about around the table. So for me, it was very simple. We have a case, and I treated it as such. When the children come back, we will continue to work in our bubbles. We'll continue to stay safe. Standard bearers children, they do wear their masks regularly. We have all the hand washing and everything. I think our protocols were very, very compliant with what Lagos State put in place. And it was a shock when we found out, but it also was a reality check for us that we can't prevent the virus. There's nothing we can do except everybody does it together. And that's really one of the reasons why I put the ebook together and why I'm talking about it, because I don't think it's something that we need to shy away from. There's no stigma associated with it. It's a reality, and when these things happen, we just have to face it head on. That's what I did.
Okay, that's a good one. We will have to go on a short break soon, but I would like you to think of the area that you come back to address when we come back from the break, because I think it is interesting what you have said about a father who has been fully vaccinated with 2 doses, yet a child from that father came down with the virus. So it's interesting to know how you will move forward, but as I said, when we come back from the break, we'll continue with the question. Do stay with us. You're welcome back. We still have with us Modupe Adeyinka-Oni, the founder and executive director of the Standard Bearer School in Lekki, Lagos, Nigeria, still speaking with us about what needs to be done in schools and educational facilities as regards COVID-19. So, Madam Modupe, as I was saying earlier, I said that it was interesting that, after being fully vaccinated, a child still went down with the virus. Now you have said that it will be required of kids to come with vaccine passports. Is that what you were trying to say, or?
No.
Yes.
Children are not being vaccinated. They're too young.
Yeah, you mentioned a passport. That's why I was curious.
The teachers.
Oh, I see.
So when our staff come back,
yes,
they will come back with COVID passports. I think regarding the children, we are having discussions with an arm of Lagos State where they're discussing whether we should have the children all do the COVID test before they come in. However, there's the other school of thought that is saying since they've gone on isolation for 2 weeks, it might not be necessary. So in going back to school, we're going to be guided by Lagos State and what they think is best. If they say that the children need to get the test done, then of course the parents will take their children for the test. But I feel that we locked down early, and if we're not seeing any rising temperatures at this time, it's very unlikely that we would get that. However, as in all things that we do, we will wait for government to guide us and bring us smoothly back into our daily physical school operations.
Fantastic. Well, on that daily school operations, there are a number of factors that are contributing to the increased transmission of COVID-19 around the world. First of these is this variance that we're seeing, like the Alpha, now the Delta. Mm-hmm. Then there's the increased social mixing and increased social mobility, as well as other factors which we'll discuss through the course of the interview. Now, how are you dealing with social distancing in your school? I just saw, we can see your school right now with all the kids together. How are you dealing with that? And how are you also dealing with sterilizing the school facility?
Okay, so we're not a very, very big school. So our population is not unmanageable. And what we actually did, we put them in year group bubbles. And so we allow them, even though we have 2 arms of the class, we see them as a bubble, and they do things within their bubble. And we're going to maintain that. When you talk about how are we going to bring them back in, so right from the gate, when you come into standard bearers, you see all the points where you'd have your hand washing and your sanitizer, and we've always done that. Also, we've always had a nurse there to take temperatures, and we've recorded our temperatures daily. And then outside every class, there's actually a point where the children can go and wash their hands. For example, they touch somebody else's thing. We as a school, even though we went back to physical school, we actually still stayed online. So a lot of our interactions from the children is still done through their laptops, so that they submit their work. The teachers don't really have to touch exercise books. So in that way, we're able to keep the social distancing to the minimum. Everybody's wearing their masks. Now, when it comes to disinfecting, we relied on a reputable organization that came in to tutor us on what we needed to do. So we sanitize our school with our cleaners go around with the disinfectant, which is just bleach and water. They wipe the children's desks regularly. They wipe the corridors because children like to touch things. Even the staircases are disinfected. And all that is going to continue. So it's not something new that we're going to be doing. We're just going to keep up the protocols as we always had them. And all the toys, everything are washed, especially for the little children. We have disinfectant. We even have little bowls where we put water. So if a child touches something, the teacher is worried, they drop it in the disinfectant for about 15 minutes or 30 minutes, depending on it, and then they can bring it out, and then they wipe it down with tissue. So if you come there, you see paper towels all over the place. I think before COVID, we had gotten it right. And now that we're going to go back, we just have to continue that. And I think because this has happened and everybody is now aware that the vaccine doesn't prevent COVID, I think the whole ecosystem is going to be even more conscious of what everybody needs to do. And with that, and with prayers, of course, we hope that we won't have to lock down again.
Mm. That's a good one. Personally, I'm aware that there are a few schools that require tests, maybe not primary and secondary school now, but for higher institutions in Lagos, privately owned. Before you step out of the school, either on holiday or for a short holiday. In returning, you will have to do, I think it's a rapid antigen, a test, just to be sure that, because you have mixed with families, you've mixed in the society, coming back to school, you have to undergo that test. I wanted to let you know that that has been happening. We don't know whether it will go to secondary and primary schools. But where I'm going actually is that vaccines are free. Yes, pupils and students are not mandated to take vaccines yet. However, tests are quite expensive, whether PCR test or the rapid antigen test. So it looks to me like we will have to go back to the 2020 era of just basically ensuring that schools and parents deal with this scourge. And we need to be ready for it, especially if the Delta variant turns out to be the, God forbid it, the expected third wave of the virus. So basically, what would be your advice to parents and to school administrators? Tests or continue with mask wearing, social distancing, and just being, aware that the danger is lurking around the corner?
Well, I can't say test, because we're dealing with children who come to school and go home daily, and who have parents who leave to go to work and conduct their business. So the advice that I think is most important at this time is that everybody is aware that the Delta variant is here. It moves fast. It doesn't really give signs initially. The fatality record is ramping up all over the world. And so Nigeria as a country and Lagos State, because of our population, we can't afford to allow the Delta variant to spread. And I think it is the responsibility of every parent to understand that even though we're not in lockdown, we are actually in lockdown.
Right.
If we want to keep our economy running, then we have to err on the side of caution by doing the right thing. I remember before, everybody seemed to think that the COVID-19 had gone away, and I kept on saying to people, no, it hasn't. And so for some people, it's a rude awakening. For somebody like myself, I'm not surprised. But it doesn't matter where you are on that spectrum of thinking. The reality is Delta variant is in Nigeria today.
Yes.
And if you want to stay alive, you have to be responsible. So the father who goes to work or goes out has to understand that I'm going back home to my little children, and I have to be responsible for them by being cautious in the workspace. Likewise, the mother who's an entrepreneur and has to meet up with people has to do the same. I would love to say that we should reduce our social activities, but again, this virus is something that we're going to have to live with for some time. So I think that more than reducing the social activities is everybody being responsible. Even if you go out, let the event not have too many people. And if they are there, let everybody be aware that we're here and we have to stay safe together.
Absolutely. It's a collaborative effort. Nigeria has tested 2.3 million samples for COVID-19 out of the country's roughly, 200 million population, right? And has administered about roughly 3.8 million vaccination, out of which 1.36 million are fully vaccinated. It's only about 7% of our population now, which is significantly low. And studies have shown that another factor contributing to the increased transmission of the virus is the uneven and inequitable distribution of vaccines. Now,
yes,
as an academic, really quickly, what advice would you give the federal government with regards to vaccine acquisition and distribution?
Thank you for that question, but it's a tough one. It's a tough one because we don't have the vaccine because we can't afford to go and buy it, right? Other countries that have the money have access to the vaccine, so we're dependent on it being given to us. I think for federal government, for Lagos State, instead of worrying about the vaccine, what we can afford is this mask. Let's make this mask available to every person on the streets. Let corporate Nigeria come up with a drive that says mask up Nigeria. Don't mask up your organization alone, because most of the people are out there. They might not even have the money to buy this, or they don't understand. I think we have to increase the awareness for this new variant and put this mask in their hands. And if we can do that and Nigeria masks up, we will contain it. I want you to also note that I think, this is my theory, that we're seeing this spike because children from the UK, from America, from South Africa, and all these places are returning for the summer. And when we had the spike in January, it was because everybody came home for Christmas. So let us all remember what happened after the Christmas vacation, where people were falling ill, and myself inclusive, I came down with COVID. And I guess that is one of the reasons why I am actually very bullish on this stay safe, be proactive thing. We have to help ourselves, help the people around us. This mask is what we have, and we have to get everybody to use it. So I don't think we can find the money to buy the vaccines for everybody, so we have to do what we can. We don't have the health care. It's this mask. And
I love that slogan. Nigeria, mask up.
Mask up. Mask up.
Thank you so much for your insight on this interview.
Thank you very much for having me. I really appreciate being here.